Hi, I'm Dr. Renee Delacqua, and today I want to talk to you a little bit about a question that many patients ask. The question is, do I have gingivitis, and what is it, and what does it mean? Gingivitis is something that most people will have at one time in their life or another. Some people have chronic gingivitis. What is gingivitis? Gingivitis is simply a term used for the inflammation of your gum tissue. If you're brushing your teeth and you're getting bleeding, or you see blood on your toothbrush, or you see blood when you spit into the sink, you know that you have gingivitis. Why do you have gingivitis? Gingivitis is caused by many different things. Gingivitis could simply be a change in hormonal balance, which would create some inflammation and swelling and bleeding of the gums. It can also be caused by stress. If you're under great amounts of stress, you will notice a difference in your gum tissues. You may even have bleeding and swelling with stress. The biggest issue is when we have gingivitis due to plaque buildup. Plaque buildup is what actually sits on our teeth. That's what we're brushing off of our teeth when we brush our teeth. We're trying to get that little film of little microbes that are sitting on our teeth. We're trying to get that off of our teeth so that we don't have deposits that sit next to our gum tissue, creating inflammation, creating sickness with bacteria in our mouths. When we have an odor in our mouths, we know that we have bacteria in between our teeth that needs to come out. How do we get it out? Flossing and brushing. Those are the only two ways to get it out. And we will talk at another time about the correct brushing and the correct flossing and what I would recommend. Is gingivitis bad? Well, we don't want to have gingivitis, but let's face it, all of us are going to have it from time to time. So, is it bad? Let's try to get rid of it. Let's not keep it. Let's make sure if we have inflammation that we're taking care of that problem, and let's make sure that we're making our mouths as healthy as possible. Are you going to die from gingivitis? No, you are not. So if you do have gingivitis, if your dentist tells you you have gingivitis, or if you're not seeing your dentist but you do notice bleeding in the sink when you're brushing your teeth, you know that you need to pay a little more attention to getting the bacteria out of your mouth. How do we do that? Flossing and brushing.